Very much, everyone. My name is Sylvia Wong. I am I'm the innovation coordinator at UNFPA, the United Nations Population Fund, and I was asked to just give a brief overview of our global crowdsourcing challenge, what it is, why we chose to do it this way, as well as how it worked. So before I do that, I wanted to give you a sense of where UNFPA and innovation is. So this, as you see on our slide, this is UNFPA's approach to innovation. It builds on and encapsulates the UN principles of innovation, what you see about creation, inclusivity, scaling, data-driven, and that is to bring about and improve the lives of women and girls and young people, particularly their sexual and reproductive health, to end preventable maternal deaths, to end unmet need for family planning, and to end harmful practices and other forms and violence against women and girls. And what you'll see, just to contextualize our global crowdsourcing challenge, you'll see across those arrows are the priorities of which we want to go about innovation, co-creating solutions, scaling, innovative partnerships, and bringing about a new culture to the organization, focusing on those 4 thematic areas. And I will share with you about how the crowdsourcing challenge that we did really touched upon those 4 arrows. So what is our global crowdsourcing challenge? It was basically an initiative of UNFPA where we wanted to go and partner with Open IDEO, which is a leading design thinking firm, and how to think about how we can inspire, collaborate, and source new innovations using design thinking with new partners beyond our traditional footprint. And what we wanted to ask was, and to the global community writ large, how might we radically improve the access and quality of sexual and reproductive health education and services for young people beyond our traditional approaches, beyond what we knew what was working for us, but to go and see what else is out there. And with Open IDEO, I would say that it was very interesting to work with them, primarily because they have a global community of 130,000 community members. So they were technologists, they were interaction designers, they were very interdisciplinary. So I think that was one of the key reasons why we chose to go with this partner as well. And so why else did we want to do global crowdsourcing? We want to expand our reach to new partners and perspectives across a wider ecosystem. So going beyond our traditional footprint of what we were doing. We want to harness human-centered design and the diverse players that I spoke to, those technologists, those designers, those subject matter experts across a range of issues, so that we can spark conversations about our challenge topic with new audiences. And ultimately, it was a way to source new ideas and solutions beyond our current approaches. So UNFPA also has an innovation fund. We had 5 rounds of internal crowdsourcing challenges to our own staff, where they were bubbling up and sharing their ideas. So we want to build a bigger footprint for UNFPA's innovation priorities beyond our staff members and their traditional partners. So that is more or less why we want to go with this approach. Just to share with you about how it worked, so it's an online platform that Open IDEO will manage for us. There are multi-stages across the process. It was very rapid and agile. You see there was a research phase. That was a phase for which we want to source and reach out to the community, and they can share their different insights of what they're seeing, either themselves in their community, what they have observed, what they've read, and they would post it online. Then there's an ideas phase, where people will provide their ideas for what solutions to address our challenge topic. Then a review phase, where across the online community, people will read each other's inputs. They would contact and reach out, collaborate, and bring in new insights to that process. Refinement, final review, and then our top ideas announced. It was new for UNFPA because it was a very rapid and agile process. It was very collaborative, open, and transparent, because all of this you can find online as well. Here, just to give you a quick snapshot of what the crowdsourcing challenge for UNFPA had generated. I should mention that this happened last fall of last year. And when we were looking back at the research phase, we could see that it was about 4 weeks. We had participation from innovators across 81 countries, different number of posts. Then it moved into the ideas phase. Again, additional posts, comments, collaboration, cross-pollination, where community managers would review ideas and just connect across the world. If it were a grassroots organizer in Uganda might comment on some other idea that is being done in Indonesia, for example, on sexual and reproductive health. So it's for connecting and creating connections across the globe. In terms of the refinement phase, I just want to share this quick snapshot so you could see that how it would look like on the platform, where different innovators would post their ideas. They would share different insights of what they wanted to do to address the challenge statement of improving quality and access for young people. And in this process, we would take, for example, the 255 ideas that were posted. They would go through a review and go through subject matter experts who would look and see, well, how can you refine and improve even further? So at this stage, we came to 55 contributions, and they had access to mentors. They would have access to human-centered design tools to help think through the challenge and solution. They would start testing and iterating their models. So this was the refined stage. And finally, through that process, after we went through 277 ideas, so we were aiming for quality in a very rapid amount. Then we went through quality, so that we had an assessment criteria, thinking, well, what does it hit on the different criteria points evaluation that we wanted to finally funnel down to our 4 top ideas? Did it respond to our challenge? Were they very did they have a promising solution with some initial support to show that it was novel and new and would bring something new to this programmatic effort? And then also, could it be poised for scale? Have they tested enough, ideated enough, received feedback from their intended users that this is worth going? There are metrics to show that it is demonstrable, and they have a proof of concept. So here is where we arrived at these 4 ideas. And you can see that they were curated, they were vetted, and they land on different ways of touching on improving the reproductive health lives of women and girls. So with that, so for my concluding remark, I would say that the crowdsourcing challenge was very new and interesting and collaborative for UNFPA. It was a way for us to expand our footprint of reaching out to new innovators, but it also helped show how UNFPA could also bring about and spark conversations on the other areas that were critical for promoting innovation, which is activating new partnerships, reaching out to non-traditional stakeholders, as well as exposing UNFPA staff to new types of ideas through human-centered design. So I'll stop there and over to, I believe, Sue. Thank you.